Today we will learn about Ewing sarcoma. Ewing sarcoma is a type of tumor. Benign or malignant? Very good. Malignant tumor. It's a highly malignant tumor. Occurs in which age group? Children, usually the second decade. At the end of the lecture, we will learn about the definition, characteristics, location, clinical features, investigation, treatment, and prognosis of this malignant tumor. Okay, this is the definition. Ewing sarcoma is a distinct round cell sarcoma of the bone that occurs predominantly in the long bone, usually in the long bone of skeletally immature patient. Immature patient means those physes not yet fused. That's why this is called immature children. Okay. Skip করবো okay. Now incidence. This slide is very important. The peak incidence during the second decade of life. Second decade of life accounts for 6 to 8% of all primary malignant bone tumor, and this is male predominant. 1.3:1 ratio. Rare in black patients. I mean African. Okay. Second decade, 6 to 8% of primary malignant bone tumor. Male predominance. Location. This is also important slide. Okay, both for Viva and as well as OSPI. Location. Ewing sarcoma has a tendency to involve the shaft of the tubular bone, long bone, pelvis and ribs. Shaft. This is a picture. Shaft, pelvis, shaft of tibia, shaft of femur, shaft of humerus. This is the ribs. Okay. Usually the diaphysis is commonly affected by this tumor. By osteosarcoma, which part of bone is affected? By osteosarcoma, the limited diaphysis. And by genital tumor, which part of bone is affected? Very good. And by Ewing sarcoma, which part of bone is affected? Diaphysis. Very good. This is the difference. Okay. And by osteomyelitis, which part of bone is affected? Metatarsus. Very good. Now come to clinical features. Every bone tumor has pain, swelling, pathological fracture. Usually present with pain, often throbbing in character, swelling, low grade fever, weight loss, generalized malaise, anemia. These are the features of malignant metastasis. Okay. Low grade pain, which is throbbing in nature. The pain is throbbing in nature, then swelling. This is the investigation. In CBC, we will get in blood investigation, we will do usually CBC, complete blood count with ESR. In CBC, we will get increased ESR. Radiology is very important, and by histopathology, we can confirm our diagnosis by histopathology. Radiology, X-ray and MRI. In X-ray, this X-ray findings is very important for Viva and for OSPE. Okay, this is aggressive, permeative osteolytic lesions and moth-eaten appearance and onion skin or onion peel periosteal reaction. And the second one is MRI. Okay. In CBC, we will just get increased ESR, but in X-ray of that affected part, we will get aggressive, permeative type of osteolytic lesion, moth-eaten appearance, and onion skin type of periosteal reaction. Onion skin type of periosteal reaction. পেঁয়াজের খোসার মতো এরকম একটার পর একটা একটার পর একটা একটার পর একটা লেয়ার হয়ে থাকে। ঠিক আছে, this is the periosteal reaction. And histopathology, another one is MRI, and by histopathology we can confirm our diagnosis, FNAC and open biopsy. Now someone tell me the X-ray findings of giant cell tumor. তুমি বলো, তোমার পাশে তোমার যে কথা বলছো তোমার পাশে X-ray findings of giant cell tumor. Very good. And someone tell me the radiological findings of osteosarcoma. Osteosarcoma তে radiological findings আমরা কি পাই? এজন্য এই স্লাইডটার রং লাল দিয়েছি আমি, এটা ইম্পর্টেন্ট স্লাইড। বলো, অস্টিওসার্কোমাতে আমরা কি পাই রেডিওলজিক্যাল ফাইন্ডিং? কেউ বলে দিবে না তোমার সামনে, বলে দিতে পারে না, তোমাকে কি বলবো? কে পারবে বলো? গত বৃহস্পতিবার আমি বলে দিলাম, আর থাকতে পড়ায়। তুমি বলো, তুমি তো ছিলে ক্লাসে, বলো। হ্যাঁ, মিক্স টাইপ অফ লেশন, গুড। দেন কে বলতে পারবে? সানবাস্ট অ্যাপিয়ারেন্স বলেছিলাম, কনভ্যাক্ট ট্রায়াঙ্গেল বলেছিলাম, হ্যাঁ, ব্রিচ অর ব্রেক অফ দ্য কর্টেক্স। পরনি, বসো বসো। Look, this is the osteosarcoma affecting the shaft of which part of bone this is? Fibula, shaft of fibula. This is the periosteal reaction, very faintly. Due to the poor quality of X-ray, this is the periosteal reaction from here. Start from here up to here. Okay. This is the present as an ill-defined, aggressive, permeative osteolytic lesions with cortical destruction of the bony cortex. Destruction of the bony cortex, mouth-eaten appearance, khawa bhab, chup, and may show onion skin appearance. Onion skin appearance means the layer of periosteal reaction. This is the layer and layer. পেঁয়াজের খোসার মতো layer and layer of periosteal reaction. This is the onion skin appearance. Okay, this is the onion skin appearance. Okay, this is one layer, this is another layer, this is another layer, this is another layer, this is the layer of periosteal reaction. Okay, this is the onion skin appearance. How can you differentiate? Suppose they give X-ray of osteomyelitis. Patient with osteomyelitis, they give X-ray in OSPE, and they also give X-ray of this Ewing sarcoma. How do you differentiate these two X-ray? Hospital তুমি কিভাবে differentiate করবে? In osteosarcoma, there is also periosteal reaction. Now tell me someone, how do you differentiate between osteosarcoma and Ewing sarcoma and osteomyelitis X-ray? Suppose this X-ray given in your hospital. Okay, how would you give them? Tell me the diagnosis and the X-ray findings. Now tell me, if your diagnosis is wrong, then your X-ray finding will be wrong. Okay, how do you differentiate? In osteomyelitis, which part of bone is affected? Periosteal reaction occur usually the metaphyseal region. But there are less periosteal reaction. But in Ewing sarcoma, there are more on your skin, more periosteal reaction affecting the diaphysis. Diaphysis, okay? Usually very destructive type of bone lesion, okay? In Ewing sarcoma. This is the gross finding. Microscopic finding. Now differential diagnosis. Osteomyelitis, osteosarcoma. Only two. Osteosarcoma or osteomyelitis. These two are differential diagnosis of this tumor. Okay. Come to treatment. Treatment is important for retail as well as the hospitals. We need multidisciplinary team approach. A multimodality treatment plan improves survival rate. Multimodality treatment plan. Someone tell me about what do you mean by adjuvant or neoadjuvant therapy? তুমি বলো neoadjuvant therapy কি? তুমি হ্যাঁ you তোমার পাশে তোমরা বসো তোমরা তো পারবে না তুমি বলো তোমার পাশে হ্যাঁ What do you mean by what is neoadjuvant therapy? প্রতিদিনই মনে হয় আমি দু একবার জিজ্ঞেস করি কে বলবে তুমি বলো তো দেখি দাঁড়ায় থাকো before the surgery to reduce the tumor size, to prevent micro metastasis, to reduce the vascularity, to make inoperable tumor operable. Okay. And chemotherapy or adjuvant after the surgery. Sit down. Very good. Boss. Preoperative chemotherapy, then wide excision or amputation or irradiation is inaccessible lesion followed by further course of chemotherapy. Just chemotherapy and surgery. This is the two options. Preoperatively we give to reduce the size, to make inoperable tumor operable, to prevent micrometastasis, to reduce the vascularity of the tumor. After that we do operation. Operation, sometimes wide local excision, okay, wide excision. Then amputation and inaccessible part radiation followed by again a course of chemotherapy. This is the treatment. ঠিক আছে চেঞ্জ করব Come to prognosis. Prognosis. তোমাদের জন্য শুধু এটুকুই লাগবে patient having localized resectable lesion treated with multi-drug chemotherapy and surgery have 70% 5-year survival rate. Those are resectable and respond to treatment chemotherapy those patient has survival rate 70%, patient has survival rate 5 years. ঠিক আছে, লেকচার তো শেষ। কোনো স্লাইড উঠানো বাকি আছে? লাস্ট স্লাইড উঠানো হয়নি? Okay. এখন আমাকে someone tell me the characteristics of this Ewing tumor. কে বলবে? কোন age group is which age group is most commonly affected by this tumor? Second decade of life. Then location? Diaphysis of long bone. And also affect pelvis, ribs. Okay. Clinical features we get pain, swelling, low grade fever, then weight loss, malaise, anemia. These are the features. Then investigation, CBCT we get increased ESR. Radiological finding in X-ray we get aggressive, ill-defined, permeative type of osteolytic lesion, okay, with motility in appearance and onion skin appearance, onion skin periosteal reaction. Okay, very good. Treatment: chemotherapy, surgery followed by chemotherapy. Okay, and prognosis: if the tumor is resectable, then 75% has 5-year survival rate. Okay, good. Percentage দাও। টিউমার অস্টিওসার্কোমা আর ইউইং সার্কোমা এই দুটাই ইম্পর্টেন্ট, আরও তো অনেক আছে, কন্ড্রোসার্কোমা আছে, এই দুটাই মেনলি ধরা হয়, কন্ড্রোসার্কোমাটাও ধরা হয় কম বেশি।